Hello, everybody, and welcome to Central Valley Today. I'm your host, Stephanie Bainham. Thanks for your time this afternoon. You know, recently the Fresno County Sheriff's Office issued a warning about a deadly drug on the streets. We're talking about fentanyl. They're blue and they have the letter M inside, a square on one side. The other side has the number 30 with a line below it. They look like aspirin you see there, and taking just one, though, could be deadly. 2 months ago, 3 people in Fresno overdosed after they took the drugs, and 1 person died. Here to fill us in on their potential deadly impacts, we have toxicologist Dr. Patil, Armenian. She's an associate professor of clinical emergency medicine at UCSF Fresno and Community Regional Medical Center. Welcome to the program, doctor.
Thank you for having me.
Wow, such a big topic these days in the news and across the country. If we could just break it down simply, start with what is fentanyl?
Well, fentanyl is a synthetic opioid drug. So opioids are typically used as pain medications, but they can they're the ones we commonly know are heroin and morphine and what you find in your Norco or Vicodin pills. And fentanyl is just a different version of those. And it's very commonly used in the healthcare setting. We use it in the hospital setting all the time to treat severe pain.
Right. But I'm sure obviously you guys are professionals and it's very, you know, the doses to give. But when folks take it off the street, or maybe they don't even know they're going to be taking it, what are some of the effects?
Yes, so some of the effects that we see is that they basically stop breathing, or their breathing slows down. They become very, comatose or very out of it, very sleepy, and their pupils get very, very small. So their eyes just get really small. And basically it looks like they're passed out and not breathing very well.
Wow. Well, you were asked to speak at the Fresno County Sheriff's conference that they had after this recent episode. Can you tell us about that experience?
Yes, so that was a great press conference where a lot of different types of people got together to let the people of Fresno and Central California know that this problem has hit home now. And the issue specifically is that fentanyl is being found in drugs that you normally wouldn't expect to find it in. So the cases that we talked about during that press conference were 3 patients who thought that they were snorting cocaine just to have a good time, and in fact it wasn't cocaine and it was fentanyl. And this is something that's being reported across the country. For example, in New York City, their medical examiner's office just recently revealed that from all the cocaine that they've seized in New York City, 2% is actually fentanyl, which is a pretty big amount.
Yeah.
Now, the other issue is that it's also being found in illicit pills sold on the street, and that's what you guys were referencing earlier with the M30 pills, which looks like an oxycodone pill, so people might think they're taking oxycodone or OxyContin, and in fact, those are illicitly manufactured pills that contain fentanyl. And this is something we have seen multiple times, not only in California, but in different parts of the country.
Yeah.
So it's pretty scary.
And you said since the press conference, there's been reports that the drug has kind of gone up the state, and they had a similar incident in Chico.
Yes, so our incident was on a Monday in January, and that Saturday there was a house party in Chico. It was reported widely in the news in that region, where there were some party goers who thought they were snorting cocaine, and 1 person ended up dying and 14 ended up going to the hospital, and they confirmed that fentanyl was also to blame in that case.
Yeah. So what's happening here? Is it that the drug dealers are spiking the product with this deadly concoction?
So in essence, yes. And so it's not that people knowingly want to take fentanyl, it's that the drugs just contain them, and that's happening at the large cartel level. And so when the drugs are being processed, because fentanyl, for example, is cheaper than heroin, they like to kind of try to substitute it for heroin, and as well as other opiates in other pills such as oxycodone or Norco, like we mentioned.
But it's much stronger.
It is much stronger. So just to put it in perspective, we already kind of we've all heard about heroin over the years and how heroin is a strong opiate. Well, fentanyl can be 50 times as strong as heroin. And then there are also fentanyl analogs, which are other drugs that are similar to fentanyl and act similarly that might even be much stronger than fentanyl itself.
Yikes.
And so you just don't know what you're getting. The problem with that is when it's so strong, even someone who is used to, let's say, using heroin or other pills or other opiates, this is so strong that it might make them stop breathing too.
Ooh. Well, as a toxicologist, and I know you work in the emergency rooms at CRMC and UCSF Fresno, what is your lasting message for folks out there? What do you want them to take away from this interview?
Well, I just want them to know that what you think you're buying on the street may not be what it is. And fentanyl is here. I think it's here to stay because it is profitable for the drug cartels. And just be safe and know that even the smallest dose of a street drug, even one that is, let's say, cocaine, for example, might not be that at all. And so I know it's a scary message, but it's just something that people need to be aware of. And if you do, let's say, one of your friends is using a drug and they collapse or something happens near you, call 911. And we also really recommend for anyone involved with, let's say, using an opiate to have naloxone, which is the antidote available. You can buy it both with and without a physician's prescription.
Well, thank you, Dr. Armenian, for your medical perspective of this very, very sensitive and serious issue. So we appreciate your time.
Of course, anytime. Thank you.